and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Jasmine Toor. She is an internal medicine physician, and she wrote the Kevin MD article, Positive Growth from the COVID-19 Pandemic. Jasmine, welcome to the show.
Thank you so much, Kevin. Appreciate it.
We'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Sure. So I'm originally from Canada, born and raised just outside of Toronto. I did my residency in Baltimore, Maryland, and that's where I've stayed. I've been working for faculty internal medicine, inpatient, outpatient role for about 3.5 years. I've always loved science, how the human body works. I love, arts, creativity. That's kind of what brings me to my pastime of writing different articles and opinion pieces, just the creative aspect. I also really enjoy lifestyle medicine, exercise and its benefits on health, and I try to practice that into my own practice. And I appreciate you having me here today.
So we're talking in the middle of January, and we're in the midst of possibly the worst wave of the pandemic. Tell me what you're seeing from your perspective, whether it's in the hospital or in your clinic as it relates to the pandemic.
With my job, I have two different kind of sides of things. I have the primary care side and an inpatient side. So I'm seeing a very wide variety of things from different directions. I've also had family member that, lost his life to the virus, and it's been tough. So I also have that perspective on things. So it's been really tough. I think the hardest thing has been for me when I work inpatient, just seeing the frustration and the loneliness of patients, and we are their family. We are the people that are there face to face. They get to FaceTime and video chat and those type of things, but it's definitely not the same. So I'm trying to take every moment I can to spend the extra minute, just to ask how they're doing and what they need, because they don't have that type of, connection that they can have from their family, so we are their human connection. From the outpatient side, it's been hard. Someone said something interesting to me. So I've lost several of my clinic patients. I've had them for the last 3.5 years, a lot of them, and they lost their lives to the COVID-19 infection. And it's been really hard because you develop kind of a sense of family from that perspective, and that's the hardest part for me. Someone said to me, "Why do you know so much about your patient?" I said, "Well, because I'm their primary care doctor." So that's been the hardest thing, just I know their family members. I know sometimes I'm the doctor of their whole family. I know what they did for Christmas or New Year's or, those type of things. And one of my patients, and this was probably the one that hit me the most, he used to call me every time a medication was recalled, just when he heard the news to let me know, but he was so careful. And that's the thing, it's been rough because sometimes you just trying to be careful, you can still get hit with it, and it's been hard. The hospitals are really, really busy, full capacity where we are too. So I don't do ICU, but I do intermediate care unit, and people are there for 20 days, 10 days, 3 weeks, a month, just trying to recover from this. And so I think what I'm trying to do, I'm just trying to be there as a doctor and as a person who just cares about their well-being emotionally and health-wise through all of this.
Wonderful. And let's transition now into your Kevin MD article, Positive Growth from the COVID-19 Pandemic. Now, for those who didn't read that article, can you just walk my audience through it and share the story of why you decided to write it?
The main reason why I chose to write the article was just because it's been a struggle for me, just like it has for so many people. So I have two sides of things. I have the normal human reaction to it, and I have the work side, which is also increased stress. So stress in both my personal and, business life. So I've had a hard time in the beginning dealing with it, just like everybody else has. I'm the type of person who likes to go out and do things. When I have a stressful day, I want to go for dinner or talk with my friends and family and see my family, or go to the gym outside and exercise, or go for a run, those type of things. And it's been hard because everything that I knew to be what I do to de-stress is quickly, taken away. So I have to kind of reevaluate my whole game plan of things. So you have kind of two things. You have increased stress in your life and work, and then you have the lack of ability to to kind of de-stress the normal ways that you can. So they're both very counterproductive, to each other. So the hardest thing for me was just to figure out a new way to kind of move forward with life. And that's kind of what brought the article on, because it's our mindset. I think that's going to get us through it, and positive thinking. It's so easy not to think positively, because I didn't in the first couple of months. Kind of we hit the thing, why is this happening to me? Why is this happening? Why can't I do what I want? Everybody is in the same boat together. And I think kind of flipping the frame of mind is the main thing that's going to get us through this in a positive way and allow us to kind of grow through the adversity that everybody is facing, like resilience.
So can you give us an example of a story of a time where you try to turn something around and look at it from a positive mindset?
One of the things I also wrote about in my article, so I live in a pretty, nice neighborhood. You can go on walks and things like that, but I never did. I'll go exercise at the gym. I wouldn't really meet my neighbors because it's just all the houses are spread out. And I think I took the time now. So, okay, I can't really go to the gym safely, or they're closed in the beginning, and I still don't feel fully comfortable just because I work in the hospital and everything too. So I took the time to say, I'm going to go on a walk. I met my neighbors from a distance. We talked to each other. I got to learn about my neighborhood. I went on more walks in the first couple of months than I did probably in 3 years of living in this area. So it changed my perspective that even though I have one way of doing things, there's other ways to kind of achieve the same goal. You just have to kind of frame your mind a little bit different. I like painting, but typically we're always running around outside, going to this person's house or that dinner or that restaurant or watching a movie outside, whatever it is. And sometimes it's nice just to take it slow and stop and smell the roses, as they say, and I've been able to do those type of things, and you'd be surprised how well it de-stresses you, and all you think about is painting and nothing else, so those type of things really made a big change. And I've just been working on kind of slowing things down, because the whole world, we move fast. Everybody is fast paced, thinking what's next to do. But sometimes you can get, healing and just happiness from the simpler things, just like we did when we were kids. If you give us a cardboard box and you put some holes and windows in it, it's fun for hours, but now we always have more complicated ways to have fun. So I think the process that I've been working on is how to simplify it and do it safely, but completely kind of flip my mindset about not why me, why is this happening to everybody, more like what can I do to grow from this and learn from this and appreciate things more.
So as physicians, a lot of us are totally consumed with, what we do clinically, especially in someone like you who have to work also in both an inpatient and outpatient setting. So how difficult was it for you to slow down and to kind of reframe your perspective to a more positive mindset?
It was difficult in the beginning because most physicians and people in the medical field, type A personalities, need organization, like to have control over their lives. And the thing is too, when you're a primary care doctor, when you go home, your patients are your patients. You think about them, you worry about them. When they're hospitalized, you worry about them. When I'm working in the hospital, I still, things are still happening to my patients. They're still struggling and having hard times with everything, just like we are, so it was hard in the beginning, but at some point you just have to say, what, we stop feeling sorry for yourself. I didn't feel sorry for myself. It was more just for society, how difficult this is for every single person. I can't imagine. The number one thing that I thought right from the beginning, I'm so thankful to still have my job. That was the main thing. I have my patients, I feel it's so hard, just emotionally. My heart goes out to anybody who lost their job or, financial issues, because although it's scary to go to work, I have a job that I can, and I don't have to worry about those type of things. I can't even imagine if it was other way. And I think thinking about that and just stopping, anytime I start getting sidetracked, oh no, this is terrible, I can't go do fun things, I have my job, I have my health, and I need to appreciate that, because not everybody got to have those two things. You know, people lost their lives in this, and also people lost their jobs and are struggling in different ways I can't even imagine. So I think that's the number one way I kind of just appreciated everything and was able to keep a positive mindset. We just have to be thankful. And I have been a person who always appreciates and has gratitude for everything that I've been given in my life. But this really brings you to that point where we have to be thankful for what we have, and grateful for what we've been given. And I use that kind of energy to kind of move forward into a positive way.
We're talking to Jasmine Toor. She is an internal medicine physician, and she wrote the Kevin MD article, Positive Growth from the COVID-19 Pandemic. Jasmine, can you share some tips and advice for your fellow frontline clinician colleagues and nurses, for that matter, on how they can proceed going forward?
I think the most important thing is to just try to work on the mindset. You know, it's very easy for negative thoughts and the stress to get to us, and a lot of us have to completely reframe the way that we do de-stress. But it's important to at least try. You know, in the beginning we just go home and say I'm so tired and kind of go to sleep and don't do anything. But we have to do things to de-stress, because, you know, burnout was high before,
Yeah.
you know, and now it's through the roof and skyrocketing, and I can see it around people, you know, just everyone around me. And I feel the same way too, but I'm trying to make a conscious effort to do things that will help me with my stress levels and kind of enjoy and feel joy in different ways. You know, I've told several of my colleagues and the residents when I'm rotating with them on service that it's important to put your health first. Healthy mind helps us take care of our patients better. We can give more support to our patients, you know, with our brains as well as emotionally. So physical, emotional, it won't drain you as much if you take care of yourself when you go home. I think one thing to do is, whatever it is, you just have to kind of sit down. Someone gave me a piece of advice early on in the pandemic, which I thought was really interesting, and I shared in my article, was that, remember when we were kids, and that's what I was mentioning earlier too, that the simplest things gave us enjoyment.
Mm-hmm.
Why don't you write those things down? Put down 10 things you used to do when you were younger that you did for fun and enjoyment, and just try them again and see what happens, you know, and you'd be surprised. So we used to have a telescope growing up. I bought a telescope, but it's amazing. Now I have adult telescope skills, you know, so it's different. So you appreciate different things, and it brings you back to childhood. You know, I loved painting when I was a child. Of course, paintings have gotten better, you know, Bob Ross videos, those type of things. Just find what you love and haven't had time to do and start doing it again. That's what I would give them, because we lose our hobbies and our pastimes to medicine. You know, we're always working, we're always thinking about work. But if you have to consciously make the decision to say, remember those hobbies and things I used to do before all of this started, not even the pandemic, but medical school, residency, working. Try to write those down, go back to the things that you love, and that will really help make a difference in how you can care for yourself and your patients.
And my final question, what's your take-home message you want to leave with the Kevin MD audience?
I think the main take home that I wanted to leave for the audience, for those who did or didn't read my article, is that it's okay to feel the stress. You know, we don't have to ignore it or pretend it's not there or try to just move past it. We need to just kind of acknowledge that it's there and do something about it. I think taking a proactive approach is the best thing, because the pandemic, just like you said in the beginning, we are at the worst right now. You know, we've lost just under 400,000 lives to this in the States, I believe was the last time I had looked at the statistics. And that is a real number. It is significant. I'm fortunate enough, I got my 2-dose vaccine series, you know, I survived, it went fine. So I'm thankful for those things. And I think the main thing I would want people to do is acknowledge the stress and try to do something about it, and try to grow from this. It's very easy when we have adversity to fall to it. I did in the beginning, and I still have hard days. It's never easy, but you have to just kind of proactively focus on resilience. You know, if I learned one thing from all of this, is how resilient everybody can be. You know, Doesn't matter who you are, where you're from. You'd be surprised. It's before they used to say no one will ever be, productive working from home. Look at everybody. Everyone is working from home. Things are moving smoothly. Life is going on. So I think just learning and focusing on appreciation, our own resilience, self-discipline, and reevaluating the things that we enjoy and bringing back the things we enjoy into our lives is going to get us through this, and support each other as much as we can. When you see someone who's having a hard time, talk to them about it, see what you can do to help, because that's what we need to do to kind of get through this together.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you. I appreciate it. Take care.